Top 25 NHS Healthcare Assistant interview questions and answers. Healthcare assistants play a vital role in delivering safe, compassionate, and person-centered care within the NHS. Interviews for this role focus not only on skills and experience, but also on values, communication, teamwork, and patient safety. The following top 25 NHS healthcare assistant interview questions and answers are designed to help candidates prepare thoughtful, confident responses that reflect NHS core values and real-world healthcare practice. 1. Why do you want to work as a healthcare assistant in the NHS? I want to work as a healthcare assistant in the NHS because I am passionate about caring for people and making a positive difference in their daily lives. The NHS values of compassion, respect, and dignity strongly align with my own personal values. I enjoy working in a role where I can support patients physically and emotionally while contributing to a wider healthcare team. Being part of the NHS also offers opportunity for learning, development, and delivering high-quality care to diverse communities. 2. What do you understand about the role of a healthcare assistant? A healthcare assistant supports patients with their daily needs while working under the supervision of registered nurses and other healthcare professionals. The role includes helping with personal care, monitoring vital signs, assisting with mobility, maintaining patient comfort, and observing changes in a patient's condition. HCAs also play an important role in communication, providing reassurance to patients and families, and ensuring care is delivered safely, respectfully, and in line with care plans and NHS policies. 3. What do the NHS values mean to you? The NHS Values Guide, How Care Should Be Delivered to Every Patient. To me, they mean treating people with dignity and respect, showing compassion, and working together to improve lives. They emphasize putting patients first, being accountable for my actions, and striving for high standards in everything I do. By following these values, I can ensure patients feel safe, valued, and listened to while contributing positively to the healthcare team and organization. 4. How would you maintain patient dignity and privacy? I would maintain patient dignity and privacy by always treating individuals with respect and involving them in their care. This includes explaining procedures clearly, asking for consent, and ensuring doors or curtains are closed during personal care. I would protect confidential information and only share it with appropriate professionals. Being mindful of language, body tone, and cultural needs also helps patients feel comfortable, respected, and valued at all times. 5. How do you handle confidential information? Confidential information must be handled carefully and in line with NHS policies and GDPR regulations. I would only access information necessary for my role and never share patient details with unauthorized individuals. Conversations about patients should take place in private settings. If I am unsure whether information can be shared, I would seek guidance from a senior staff member. Maintaining confidentiality builds trust and protects patient safety. 6. How would you deal with a distressed or anxious patient? I would remain calm, patient, and empathetic when dealing with a distressed or anxious patient. I would listen actively, acknowledge their feelings, and reassure them that their concerns are being taken seriously. Using clear, gentle communication and offering practical comfort can help reduce anxiety. If the patient's distress continues or worsens, I would report this to a nurse or senior colleague to ensure appropriate support is provided. 7. How do you manage challenging behavior? When managing challenging behavior, I would stay calm, respectful, and non-judgmental. I would try to understand the cause, such as pain, fear, or confusion. Using clear communication and de-escalation techniques can help prevent situations from worsening. If necessary, I would seek assistance from colleagues and follow organizational policies. Patient and staff safety is always a priority, and incidents should be documented accurately. 8. How would you respond if a patient refused care? If a patient refused care, I would respect their right to make decisions about their own body. I would calmly explain the importance of the care and address any concerns they may have. If the patient continues to refuse, I would report this to a nurse and document it appropriately. Respecting autonomy while ensuring patients are informed is essential in providing ethical and compassionate care. 9. How do you ensure good communication with patients? Good communication involves listening, speaking clearly, and adapting to individual needs. I would use simple language, avoid medical jargon, and check understanding. Nonverbal communication, such as eye contact and body language, is also important. For patients with communication difficulties, I would use appropriate aids or seek support. Effective communication helps build trust, reduces anxiety, and ensures safe, person-centered care. 10. How do you work as part of a team? Teamwork is essential in healthcare. I work well with others by being reliable, respectful, and supportive. I communicate clearly, share relevant information, and ask for help when needed. I understand my role within the team and follow instructions while contributing positively. By working collaboratively, the team can provide consistent, high-quality care and ensure patient safety at all times. 11. What would you do if you notice a change in a patient's condition? If I notice a change in a patient's condition, I would report immediately to a nurse or senior staff member. Observing and reporting changes is a key responsibility of a healthcare assistant. I would provide clear and accurate information about what I observed and when it occurred. Prompt reporting ensures early intervention, helps prevent complications, and supports safe patient care. 12. How do you handle pressure in a busy environment? I handle pressure by staying organized, prioritizing tasks, and remaining calm. I understand that healthcare environments can be fast-paced, and patient needs may change quickly. I focus on what is most urgent and ask for support if needed. Taking short moments to breathe and communicate clearly helps me manage stress while continuing to provide safe and compassionate care. 13. What infection control measures are important in your role? Infection control is vital to protect patients, staff, and visitors. Important measures include hand hygiene, using personal protective equipment correctly, following cleaning protocols, and disposing of waste safely. I would also follow isolation procedures and report any infection risks. By adhering to infection control policies, I help prevent the spread of illness and maintain a safe healthcare environment. 14. How would you support a patient with personal care needs? I would support a patient with personal care by being respectful, gentle, and maintaining their dignity. I would explain what I am doing, gain consent, and encourage independence where possible. Being aware of cultural, religious, and personal preferences is important. I would ensure comfort, safety, and privacy while following care plans and reporting any concerns to senior staff. 15. How do you prioritize your workload? I prioritize my workload by assessing which tasks are most urgent and important, particularly those affecting patient safety. I follow care plans and instructions from senior staff. If I am unsure or feel overwhelmed, I communicate with the team to adjust priorities. Good organization and communication ensure tasks are completed efficiently without compromising quality of care. 16. What would you do if you made a mistake? If I made a mistake, I would report immediately to a senior colleague. Being honest and transparent is essential in healthcare. I would follow incident reporting procedures and reflect on what happened to prevent it occurring again. Learning from mistakes helps improve practice and ensures patient safety remains the top priority. 17. How do you show compassion in your work? I show compassion by listening, being kind, and treating every patient as an individual. Small actions, such as offering reassurance, taking time to listen, or providing comfort, can make a big difference. Compassion also involves understanding patients' emotions and responding with empathy. This approach helps patients feel respected, safe, and cared for during difficult times. 18. How would you deal with a complaint from a patient or family member? I would listen carefully to the complaint without becoming defensive and acknowledge the person's concerns. I would remain calm and respectful, apologize if appropriate, and report the issue to a senior staff member following local procedures. Complaints provide opportunities to improve care, and handling them professionally helps maintain trust and positive relationships. 19. How do you maintain professional boundaries? Maintaining professional boundaries means being friendly and supportive without becoming overly personal. I would avoid sharing personal information or forming inappropriate relationships. Professional behavior ensures trust, respect, and patient safety. If I felt boundaries were becoming unclear, I would seek advice from a senior colleague or supervisor. 20. What experience do you have relevant to this role? I have experience supporting individuals with personal care, mobility, and emotional support. I am familiar with working in team environments and following care plans. My experience has helped me develop strong communication skills, patients, and an understanding of confidentiality and safeguarding. These skills prepare me well to provide high-quality care as a healthcare assistant. 21. How do you support quality and diversity? I support quality and diversity by treating everyone fairly, respectfully, and without discrimination. I recognize that patients come from different backgrounds and may have different needs. I adapt my approach to respect cultural, religious, and personal preferences. Promoting inclusion helps create a safe, welcoming environment and ensures all patients receive equitable care. 22. What do you understand about safeguarding? Safeguarding involves protecting vulnerable individuals from harm, abuse, or neglect. As a healthcare assistant, I must be alert to signs of abuse and report concerns promptly following safeguarding procedures. I understand the importance of confidentiality and accurate documentation. Safeguarding ensures patient safety and upholds the NHS duty of care. 23. How do you keep yourself motivated in this role? I stay motivated by remembering the positive impact my work has on patients' lives. Helping someone feel comfortable, safe, or supported is rewarding. I also value learning new skills and receiving feedback. Working as part of a supported team and contributing to patient well-being keeps me motivated and committed. 24. How do you handle feedback or supervision? I view feedback as an opportunity to improve my practice. I listen carefully, ask questions if needed, and reflect on how I can develop. Supervision helps ensure I am working safely and effectively. Being open to feedback shows professionalism and a willingness to learn, which is essential in healthcare. 25. Why should we hire you as a healthcare assistant? You should hire me because I am compassionate, reliable, and committed to providing high-quality care. I understand the responsibilities of the role and align strongly with NHS values. I work well within teams, communicate effectively, and prioritize patient safety and dignity. I am eager to learn, develop, and contribute positively to your healthcare service. Preparing for an NHS Healthcare Assistant interview requires a strong understanding of patient care, teamwork, and NHS values. By practicing these questions and answers, candidates can confidently demonstrate their compassion, professionalism, and commitment to high-quality care. Success in the interview comes from showing not only what you can do, but who you are as a caring and dependable healthcare professional.